Ulcerative colitis is a chronic inflammatory condition of the large intestines, which is characterized by development of ulcerations in the internal lining of the large intestines. Colon is part of the intestinal tract. The main function of the large intestines is to absorb water.
By definition, ulcerative colitis starts at the very end of the colon and can extend farther towards the beginning by any different amount. Some people have just the rectum involved, we call that ulcerative proctitis. Some people have the rectum and then the next segment of colon involved, we call that proctosigmoiditis. The next group of people, it extends farther up into the descending colon, and we call that left-sided colitis. And some people, the entire colon is involved, and we call that pancolitis. So the symptoms are really the same, whether somebody's having a new presentation or a flare-up. Bleeding, diarrhea, urgency, abdominal pain. As it becomes more severe, the pain becomes worse. People feel more tired. They lose their appetite. Sometimes people have a fever, they have malaise, weakness. If you're bleeding, you can become anemic and iron deficient. If you're having diarrhea all the time, you can be losing protein, nutrients, electrolytes, fluid, become dehydrated, everything that goes along with that.
Ulcerative colitis may lead to a variety of complications which are not always related directly to the intestines, but to presence of chronic inflammation in the body. Sometimes it may damage liver, and sometimes in rare situations it may lead to development of cancer in the colon and rectum.
Sometimes people have eye manifestations, iritis, uveitis, things like this, episcleritis, where the eyes become red and painful and very irritated.
Precise reasons for ulcerative colitis are unknown, but there are several theories behind the disease development, and they include genetic predisposition of certain individuals, reaction to certain food we eat, abnormal inflammation, and protracted inflammation when the inflammation continues beyond the infection or other trigger already is gone from our body. Ulcerative colitis often presents in patients who are young adults or adolescents, and also in patients who are 60 or older. Most patients diagnosed with ulcerative colitis will require consultation with gastroenterologists, full colonoscopy with biopsies to confirm the diagnosis, and they will need to initiate medical therapy for their disease.
But primarily, the goal of treatment these days is not just to deal with the symptoms, but to really try to get the underlying inflammation to be under control so that the patients don't have symptoms that need to be treated anymore.